Throwing out his pet. Long. I see you downstairs. What? Do I hear that it's Trustee Kamani Levy's birthday? Okay. No, if I had known, I didn't say I was go by.
There's brownies down there.
Turns here, maybe we could get a special variance for this.
Yeah. Yeah, I don't know.
Happy birthday, thank you for the.
We get all of our budget in this, for sure.
Okay, I will call this meeting to order and I will ask that our village clerk, then I'll decide, please call the roll.
Trustee Pearslovan,
Here.
trustee Schechter, here, trustee Kay Levy,
Here.
trustee Robinson,
Here.
trustee Iverson,
Here.
trustee L Levy, here, Mayor Tennis.
Here, and we have a quorum. We will start off tonight with our fire departments. We have our chief, Jeff Hoflick, we have our deputy chief, Nick Eschner, deputy chief, Steve Jan, Steve, and Ryan Hall, our engineer. Thank you for being here. The budget message is on page 64. The detail is on page 241. And there was a handout that I believe mirrors what we're going to be seeing. So, take it away.
Thank you. Thank you, Mayor, and thank you, trustees. Dr. B, it's a pleasure to be here again. This is, I think, my 6th budget hearing. So I still don't feel like I'm an old pro at this. Hope to get through this as efficiently as possible. I think I want to start out just thanking the board for the continued service throughout my career. I think this village of Skokie really sets a high standard for service. That's certainly our large part of what the fire department's all about. It's our mission. And we take that very seriously. And it's great that we have the support of the village so that we can provide that service at the highest level possible and in a safe way for our personnel and the community. I also want to acknowledge my staff. My 2 deputies are outstanding in what they do. They make me look better every day. That's sometimes hard to do. And they really complement me well with the skill sets that they have. Ryan Hall is a newer addition to our team and he's awesome, but every member of the organization, every admin, the Fire Prevention Bureau staff and all the operational personnel, paramedics, they all do an outstanding job every day. And we all feel it's our job to support the work that they do on the streets. And it's really important that we do what we can because they're busy. They do a lot of work and we appreciate the support that you all give to us so that we can support them. I'll start out with, I'm going to go through a PowerPoint and just touch base on a few things. So we are still an ISO class 1 fire department. We have been since 1995.
Chief, may I stop you? For the benefit of the new trustees and those who might be listening, would you expound on what ISO is?
Absolutely.
Thank you.
So ISO is a independent office that rates a community on its fire protection and fire protection capabilities, not just the fire department, but water supply, communications, dispatching, etc., training levels, equipment, staffing levels, the type of apparatus you have. So it's very objectively measured. And then they use that information to determine the classification of the fire department. And so we are ISO class 1, which is the highest level possible and have maintained that, as I said, since 1995. So it's quite an accomplishment. I think there's 29 communities in the state of Illinois that are ISO class 1. And so with that, the insurance companies, then insurance contractors or companies then use those classifications to determine the insurance rates that they're going to provide to their customers. So if you have an ISO class 1, you're going to be paying less in your premiums, for whether it be your home or your business. So obviously it's an advantage to the residents there, but I suppose that's great. You're welcome. One of the other things, a couple of other things that we accomplished, or we continue to work on is, community risk reduction. Our Fire Prevention Bureau has done an outstanding job with that, and we'll talk a little bit more about that as we go through the PowerPoint. And then another, I think, major focus for us is our professional development. We really focus on making sure that our staff is highly trained and qualified as possible. So we do a lot of training every day, to make sure that they're able to do all the tasks that are required of them. And that's a broad range from EMS to fire to rescue. And so there's a lot to learn, and our staff does a great job of making sure that they're prepared to do their job. So with that, I'll get started with the PowerPoint and kind of touch base on some of our 2024 accomplishments. In 2024, we expanded our capabilities of providing ALS service by putting ALS equipment and paramedic staff on three of our fire apparatus, and we're prepared to do that with additional fire apparatus moving forward. And so when the ambulances are busy, which is frequently, that first fire apparatus that arrives with ALS equipment can now provide the same level of care that the paramedics on an ambulance could arrive. They just can't transport. So there's no delay in providing that high level of medical care until an ambulance arrives. Another thing that we completed was our community risk assessment, which was a pretty lengthy process, very comprehensive, and I hope that you've had an opportunity to review it. It is on the website. That fits well within our process for accreditation, and helps us work on our strategic plan, and you'll see that further in the PowerPoint as well. We also implemented a new fire station alerting system, which is a major step forward, and compliments to Deputy Jagman for kind of seeing that one through. And so that basically is the tool used to alert our personnel that are in the station, and so they hit the street as efficiently as possible. And there's some tools in it, or technology that allows us to really determine who's going to get that alerting, so that we're not necessarily disturbing the whole department. As busy as we are, it's nice that we can focus that alerting to a specific station that's due on a call. So it's been a nice enhancement. We of course put the new tower ladder in service in January. I think some of you were able to be there for that, and that's up at Station 18. We refurbished and re-chassis two of our ambulances, and the third one is in the process of being done right now. And that will be going in service at Station 18. And so what that entails is we basically took the old patient compartment box, refurbished it, and then put it on a new chassis. Doing that for the three ambulances cost savings of about $600,000. But probably even more importantly, as far as we're concerned, is it allowed us to move along faster than having to wait for a totally new apparatus. So really a win-win for the department and the village. We also finalized specifications for two new engines and a new squad, and those are going to be built late fall, and we expect delivery of those in December or January. So we're excited to get those. And then we've expanded our fire explorer program. It's the program we're super excited about, and it's going extremely well. A number of our firefighters are advisors, and are doing a great job with the program. And we have 20 active, very active members of the explorers, and so that's been a nice addition to the department. And then we also host another Citizens Fire Academy, and any new members that would have an interest in learning more about the department, you'd be welcome to attend a Citizens Fire Academy.
Chief, I'd like to commend you, the staff, on the Fire Explorers program. I know that was, I think maybe they had it a long time ago, and then it went dormant, and maybe we never had them, but I remember having conversations about it, a number of years ago, and to have it now in place, so robust, and I just think it's great. So good job.
Thank you. I am thrilled, but I have a scouting background. My son is an Eagle Scout, and so I've always been passionate about scouting. And I always wanted to have one started here in Skokie. I don't know that the fire department, I think maybe we had one years and years ago, long before I was even employed here, so that's going back a ways. But police have had a successful Explorer program, and we're thrilled to have one, so thank you. Real quickly, just response statistics, so another busy year, 11,336 total responses last year. Of those, 7,522 were EMS, so about 65% of our call volume is EMS. And we treated 8,794 patients. Approximately 126 fire incidents, and of those, about 36 of those were structured fires of some type. Now, that may not be a fully involved structure, fortunately, but a fire within a structure that for the most part, we were able to mitigate pretty well. I mentioned professional development, and so you can see we're busy with training, over 30,000 hours of training done in the year, which is more than meets our requirements from most State Fire Marshal, ISO, Secretary of State. We have several training mandates that we have to make sure we achieve each year. And then we also had 68 of our members complete an OSFM course, which is might be a robust course or a vehicle extrication course, fire academy course. So that's a pretty good number. We have a very young department, so we do have to work to keep up with that. Okay, our bureau has also been very busy. 1,800 fire inspections and typical very busy with plan review. And our bureau specialists do an outstanding job, so it's going to acknowledge them. Right now, I'm going to kind of get into a few things that kind of talk to, to a broader subject that we've talked about a little bit as far as some of the needs moving forward for the department. So if you see the map there, our still districts, the blue represents station 16, red is station 17, and the green area is station 18. Those are based on the locations of the three stations, 16, 17, 18. And although it's not the biggest by square miles, station 18 is by far the busiest of the districts that will provide service. And that's largely due to the population density within that district.
Chief, may I ask you a question? What are those, the 8,000 numbers that are within the different subsets?
Those are the census tracts.
Census tract, thank you.
And so we are able to track information based on census tract as well. So if we need to narrow in on something, we're able to.
Thank you.
Then there's the three stations. So we have station 16, which was built in 1968, station 17, which was opened in 2003, and station 18, which was built in 1959, opened in 1960. And so one of the things I do want to talk about is the age and condition of station 18, and what I see as a need to replace that station. And we'll talk a little bit more about that as we go. Okay, the next slide is basically a breakdown of our emergency medical response types. And as you can see, we go on a wide variety of calls for both EMS and non-EMS. This particular breakdown is for EMS calls. And so a large amount of those calls are general illness. We can transport those patients to Skokie Hospital or St. Francis or to Evanston. But you can see some of the calls are for cardiac or some respiratory, some stroke calls. Those types of calls, we are required in most instances to transport to St. Francis or Evanston Hospital because they're able to provide the level of care for that type of patient. And so that's because of the recent changes at Skokie Hospital, not providing care for stroke victims or cardiac patients. It's requiring us to transport more of our residents outside of Skokie, which then in turn ties up the ambulance longer and keeps us out of service for a while, which is going to tie in a little bit further when I talk about discussion on a port ambulance. Next one is incidents by property use, and this one just kind of breaks down where we go for these calls. And as you can see, by far, the most of our responses are to residential properties. That's not unusual. I mean, that's obviously where most people spend the majority of their time. And certainly people who, especially for EMS, people that are elderly are probably home more, and so they're more apt to be transported from their homes as well. The next one is incidents by category. This is looking at all types of calls. And so you can see the EMS is about 66 or 65% of our calls. That's the orange section. And then the other breakdown is a variety of things: fires, rescue calls, a lot of service calls, and we do provide a lot of various forms of service to the community. Yes.
I heard you mention some of the calls when you go east to Evanston and St. Francis. Are there any cases that you go west, like in general?
So we work with our the St. Francis, who's our what's the proper word? Resource. Yeah, resource hospital, and they help us to determine where we should transport to, and so we work under those guidelines. We would only transport to Lutheran if there was a major incident that they required us to, or if it's a person that has smoke inhalation or CO poisoning that requires a hyperbaric because the other hospitals don't have that. So we would take the patient to Lutheran for that kind of care. Otherwise, it's going to be based on the closest level 1 trauma center if that's what the patient needs, or the closest stroke hospital if that's what the patient needs. And in any case, the closest hospital would be either St. Francis or Evanston for that type of care.
Thank you.
And for us to bypass that, we would need the doctor's authorization to bypass that.
Thanks.
And then, and obviously, from an operational point of view, we have concerns about taking an ambulance to Lutheran because of the amount of time. It's about an hour at least turnaround time. So that's keeping that ambulance out of service for a long time. We're typically, especially Evanston and St. Francis, we can get in town pretty quick after a call. So. All right, next breakdown is emergency response types, and basically this one is for total incidents. And so again, it has the 11,000. If you can see each year they've steadily gone up. 2020, the COVID year, actually our call volume had actually gone down a little bit in 2019, and that's because a lot of people had chose not to go to the hospital or really anywhere out of their homes. And so our call volume did go down a little bit, but then it's progressively gone up since then. And then the next one is just EMS, and so same, the bar graph almost looks identical. Total calls in comparison to EMS calls. That's because all types of calls are increasing. And this next one takes a much longer or broader look. So this is going back, the graph goes back from 1963 to 2023. So I'm sorry, 53. Thank you. You're actually fine. So it's obviously a steady increase. And so in 1969, that's where that one jump is. When we basically had the three stations roughly where they're at now, although station 17's moved, it's still district has remained the same. We responded to 3,532 incidents in that year, as opposed to 11,145 incidents in 2023. So you can see the significant jump over that course of time.
Is part of that ability to respond to more calls, better technology?
Yes. There's a lot of factors. Technology, the demand is there, so that there's just more of a need for us to respond to more calls. The versatility of the services that we provide, the demand for the services we provide, but then certainly technology helps allow us to do that. And then we've also, through the time we'll talk a little bit about it, we've actually made adjustments in how we handle certain calls so that we can free companies up faster and be ready for the next call. So as I mentioned earlier with the one graph that showed where we respond to in residential, the majority of our calls are residential properties. That ties in with the new residential developments that are planned and going on in the northwest corridor of Skokie, particularly along Old Orchard Road. And so there's 3 major residential developments in that area, and so that's going to be impactful for our call line. It's natural to expect that our call line will go up with those increased residents in those areas. This next one is a heat map of basically of our response time analysis of our current stations. So stations 16, 17, 18, and they have their overlap. And you can see for the most part, our stations were laid out very well. And have served the community well for a long time. But there are a couple areas to the northeast and northwest that our response times aren't what we consider acceptable standards, and areas that are of concern. And a greater concern for us is the fact that one of the areas that's our biggest weakness, which is at Old Orchard Road near the courthouse, is that weakness might be further compromised with the expansion of more residential property in that area.
Gee. What accounts for the hotspot right in the middle of the map?
So that's just where that's where the red just indicates that those are 4 to 5 minute
That's a country.
response time. So it's not necessarily a heat hot spot. It just means it would be 4 to 5 minutes. So it's kind of like the center between all 3 districts. So
So it's kind of so that is represented, that's sort of like an outline area.
of any one district. Yes, of any one district. So it still falls within our response capabilities in 4 to 5 minutes, but that's it. It's kind of reaching that limit. Yes.
So quick question, I heard you say, as far as response time. So I know there's a community to the north that has a fire station right out behind you. What's their partnership and relationships with you guys? I know you handle a lot of transit that are on the highway off, for example. Now, what's your threshold of time when it go as far as, going north? And those guys coming south, but what's this response or response now?
You mean the time wise?
Yeah.
So we try to have a 5 minute response time, but that in certain areas that's just not possible. And we do our best to get there, but we do have agreements with our neighbors. And like right now, it's especially challenging with Old Orchard Road being shut down. In actuality, we're helping Wilmette out because for them to get anything going northbound in an area that's northbound Edens, what would be in their district, they would actually have to come all the way down to Dempster to get on. So they're notifying us when they receive that call, and we're getting on that call right away because we can get on at Dempster much faster. And they would reciprocate the same. So when the bridge is under construction and we're gonna have challenges going southbound from Old Orchard, they'll be able to reciprocate and get on at Lake Street for us. So this next chart shows the number of responses per station. And so if you can see the average line there, and then the 3 in red are stations 16, 17, 18. Station 18 is the one on the far left, which is our busiest station, and it's actually the biggest station. So we have 3 fire apparatus and an ambulance that run out of that station. So that counts partially for that call volume, but that call volume is impactful to us. Every time a tone goes off, but pulse rates go up, people are alerted from their sleep. If they are sleeping, it's the middle of the night. Obviously there's some stress attached to that. So the number of calls that come out of any one station is something that we try to monitor and manage as best we can. Especially when it's as significant as station 18, it's more than double the average of the other communities. So something that we're mindful of.
Excuse me, trustee Schechter has a question.
I thought if you go back to the other slide, I thought that the 11,136 were all got the entirety of the village, not just Station 18.
Yes, so these are actually unit responses, not total responses. So in other words, so that would be the total number of calls going out of that station. So that would say, let's say ambulance 18 went out on 4,000 of those calls, and the engine went out on 3,000. The total of the 4 rig went out to the level, whatever that number is.
Right, it's just that there's on this bar chart. Is that just a coincidence? It was, that's up to 11,000?
Yeah, I don't think that is actually the same number. It's close to it though. Yeah, I can't actually. But it's, yeah, it's just, that's the units running out of that station. And so as I was talking about what coincides with that is the stress level, the lack of resources that when those units are tied up, especially when we have multiple unit responses, and then this increased growing demand. And as we saw from the earlier slide, going back from 1969 or 1968, that call volume just keeps going up and up. And we've done things to kind of counter that as best we can. And so the next slide kind of touches base on that. The fire apparatus, we have fire apparatus respond for invalid assist calls instead of the ambulances. That's helped reduce the load on the ambulances by 735 incidents in 2024. We actually did that change quite a while ago, and so each year we're seeing that relief for the ambulances, and that's making the ambulances that much more available. In 2020, we started diverting automatic trouble alarms through the use of technology and the battalion chief discerning the severity or the actual problem. And so we've eliminated most of the responses that were occurring with those trouble alarms. And we're diverting those calls to the Fire Prevention Bureau as best as we can. So that's in last year that was 478 apparatus responses that we were able to eliminate, and so that's helping. We also are utilizing technology to reduce elevator alarms, and then we've also taken ambulances off of our automatic fire alarms, and that was about 1,000 less responses for our ambulances in the year. So by making those changes, so we're doing the best we can to try and one, take some of that load off for our people, and two, just make sure that we have the resources available to serve the community as best we can. So this next slide kind of shows the responses per district, and as you can see, the blue, red, and green. The blue is 16, red is 17, and green is 18. And clearly, Station 18's district is by far busier than the other stations, and busier than any of our neighboring communities as well. And I'm going to skip ahead then to skip up to the next one. The number of incidents per ambulance. This one is a comparison taking into account when we first went from 2 ambulances to 3 ambulances. So we used to just have 2 ambulances, one at 18 and one at Station 16. And in 1998, 99, they did a study and they determined that it was necessary to put a 3rd ambulance in service. And so that sort of coincided the construction of Station 17. And so that ambulance went in service, I believe, in 2002. And the first full year, maybe 2003, and then the second full year of service in 2005, you can see on the chart indicates that there was 1,981. That was the number. That was the average number of calls for the 3 ambulances. That was the first year that we had 3 ambulances in service. Before that, it was about 2,444 calls. That's what kind of triggered the determination to go to a 3rd ambulance. And so now in 2023, we're running 2,868 calls on average per ambulance. Of course, it's not really on average, because ambulance 18 is absorbing the bulk of that load. But all three ambulances are well above what is average in our neighboring communities, and above the average of what we thought was appropriate 99. So I think that's a pretty good indicator of the need to give a fourth ambulance some consideration. The next bar graph, it shows ambulance out of district responses. And again, this is just showing the number of times that ambulance 17 or 16 are having to leave their districts and take a call instead of ambulance 18's district, just because of their high call volume in that district. And then this last bar graph is kind of indicates what the effect would be of putting a fourth ambulance in service. So if a fourth ambulance were to be put in service, then it would pretty much level out the calls among all four ambulances. Definitely reduced the load for ambulance 18. So along with the service enhancements we've done, or the things we've done with our operations to make sure we're able to maintain our services, we've also done some cost of service enhancements. We've worked hard on grants, and I credit the deputies, particularly DC Eschner's work on the SAFER grant, and we got a SAFER grant for 3 positions that staffed it for 3 years. That was a $1.4 million grant. And then we had oh my God, more out of order. I'll back up. We also one of the things, some of the things that we're going to have to look at if we make these service enhancements. I'm sorry, I kind of got ahead of myself.
Go to the next slide.
No, I think I'll just back up. Then I'll backtrack. You excuse me. So I understand that a new station is expensive, and I understand that the fourth ambulance is expensive. There's some significant costs associated with that. With the SAFER grant, that when that expires in October of next year, that will be, cost about $500,000 to fund those positions moving forward, unless we qualify for another SAFER grant. We are currently working on one. A bond issue for a new station would be about $1.4 million impact annually for the village. And the cost of staffing and equipping a fourth ambulance would be about $1.4 million annually. So I do understand that there's a significant cost for these enhancements, but I do feel that there is a need for them.
Can I ask you a question about new fire station? Do you think that there is any ability to build a second level on station 18 and make that whole first floor like an ambulance and engine bay, and have the living quarters upstairs? Or is that not as safe or as effective as a new station that's all on one floor?
So it would not be as operationally sound. It would slow our response times a little bit, just having to go downstairs. There used to be poles that we slide down, but those are pretty much removed fire stations. So going downstairs does take a little bit of time. But there's other considerations. Construction wise, there would probably be some significant cost to that. And then redoing the bays. The current bays would not accommodate a fourth ambulance in that station. And then the other consideration is the actual now you're having even more calls go out of that one location, which is something that we're mindful of. And then with the development on the northern part of town, we think it makes sense to move the station a little further north, or have a station further north, so that we're better able If you look back at the one heat map, you can see that our northeast and our northwest quarter, quadrants are most challenging to make the adequate response time, so moving the station just a little north might help with that.
And so if station 18 moves north a little to help with that congestion, does station 16 then start serving more north to adapt to the new radius of the station 18?
Yes, so that's one of the factors that has to be determined, because the further north that station goes, the more impactful that is to the southern part of 18's current district, which is basically around Main Street. And so like Lincoln and Grosse Point Road would be impacted, Main Street, Skokie Boulevard, and just south of there. So yes, it would make sense then to bump 16's district a little bit further north to accommodate that if necessary.
Chief, I have a question, and we'll go to trustee Robinson. I just want to be clear, is this recommendation for a new fire station to replace station 18? Or is it to keep 18 in some measure of service and open for the station?
That decision remains for the board. We'll present information both ways. There is advantages to having some apparatus at station 18, especially with coverage for the Eads Expressway, and then as we talk further south. But then there's obviously, possibly some additional costs, like the sort of keeping two stations.
Staffing.
Well, staffing wouldn't have to necessarily change it one way or the other, because that staffing might be, like if we kept an ambulance and a squad, say at 18th district, where ambulance station 18 is now, and then move the other apparatus and an ambulance and a new ambulance, the staffing would be the same as if we just added a fourth ambulance for the station, like that. But you're still keeping more equipment, open, more stations, staffed, or I should say furnished, whatever, so.
Trustee Robinson.
Yeah, first of all, I appreciate the proximity and response time. That's why I was trying to make response time. So what makes sense to me is having a different space north. Have you guys started looking at property, eyeballing about the area that would maximize that response time?
We have, and we've done some mapping, and I wouldn't want to share any one location in a public forum at this point. But we have done some mapping and have consulted with the manager's office on some of those possibilities. And there are a number of options. Obviously, land is premium, especially up in that area where you have a mall, anywhere around the mall. Property is a premium. And then there's also the factor of, depending on how far north you go, that impacts, further south, depending on what we do with station 18.
Trustee Iverson.
Chief, is it too early for you to have sort of worked out estimates for how much response time can be aided by adding or replacing station 18?
No, I think we've gotten some analysis. We were able to plot out, we started out probably with about 8 different or 7 different locations, roughly, and then we narrowed it down to about 4 that seemed like maybe they could work, and we did some analysis on those. There's some additional work that needs to be done. There's a lot of factors. Obviously, we're able to respond with fire apparatus like siren a little bit faster than a just a resident can, but there's still limitations to that as well. And one other thing that we actually have done is we use preemptive devices on a lot of the traffic devices, and the village actually has invested significantly in that. To my knowledge, all of the village-owned intersections or village-controlled intersections have been outfitted with preemptive devices. We're working to get the ones that are county or state controlled, and those are a little bit more expensive and a little bigger undertaking. And so that would also help us, though, if those are fitted with what people call opticoms, that allow us to capture control of that intersection.
Okay. Along those lines, that the map that you put up with the red and the response times, it's super useful map, but it also illustrates how the red is already well distributed on the map. Of course, with all the new construction, that's gonna add all of that additional load without alleviating at all the loads that all around it. And that's why when Mayor Tennis suggested perhaps adding, I found that very interesting, because you really got a load problem, but from the standpoint of communication and coordination, I have no idea how complicated that would be. But I do think that might be worth looking into a little bit.
Trustee Pierce Sloan.
Thank you, Mayor. Two questions to you. Thank you. The first question is 1.4 million for a new fire facility. Does that take into account on the budget the capital facility as well? Because then you're not selling that property.
I don't think we would sell that property anyway, because it's connected to Public Works, so I'm sure Public Works, if we were not using it, I'm sure Public Works would feel the need to use
So we
it.
have to look at it from a budgetary perspective of a new property and retaining the property.
Right, so that wasn't part of the financial analysis.
No.
There was no sale. Okay.
Okay, thank you. And then the second, thank you. And then the second question is, clearly you show us a need for a fourth ambulance. How quickly are you asking this budgetary process, this board? Is it 2026, 27, 28 projection? When are you looking for that? I mean, I think that's a building the same, it's obviously expensive. I would think it's easier not than to find property and start building in the fire.
So, I have a little bit about that further on in the power right here. No, that's okay. So the steps the village has already taken, so they've been supportive with increasing number of paramedics. We've been increasing the number of paramedics every year. And we're now retaining those paramedics, so that not only can they staff our ALS fire apparatus, but that'll also beef up our numbers over time to staff that fourth ambulance. Now, that won't happen overnight, and so it would take maybe a year or two to have adequate staffing level to staff an ambulance 24/7. But we feel that we could pretty quickly put an ambulance in service during peak hours. And there's a graphic here further on that kind of shows what the peak hours are. And so, you know, we could staff maybe for 8 hours a day, maybe just during the weekdays, or maybe even just on our training days where our resources are really truly stretched to their thinnest. And that would allow us to kind of phase it in. Most communities that do add an ambulance actually do phase it in over time. Most recently Arlington Heights and Glenview, Evanston have all kind of taken that route. And I think it just makes sense. And honestly, you get the biggest bang from the village's perspective. You get the biggest bang for your buck, because that's when your ambulance calls you truly are the busiest, and so you're adding the resources when you need it the most.
Yes, good, the police taking that. We talked about the northern corridor, that's it is, serving. How does Old Orchard draw, how many calls do you think that are out there? We're proud of the revenue we get from Old Orchard, but what are we doing in services?
We don't really run a ton of calls. We do go there for various calls, but it's not an astronomical amount. I could provide that or have that
No,
information.
just put in your gut, it's not like it's
Yeah.
really drawing from the services.
No.
Be great,
So it's more the residential.
Yes.
okay, it's good. Thank you.
Any other questions before the chief continues?
So, so we have done some things, knowing that these, that resources are stretched, that we worked with the manager's office, and we've done a few things to improve our revenue enhancements. So over the time, we've increased our ambulance billing rate. And this is raising a significant additional revenue. And the nice thing about it is that there's no impact to the residents for that. We only bill and accept the revenue from the patient's insurance carrier, Medicare and Medicaid. And then this kind of similar with the next enhancement was we started participating in the Ground Emergency Medical Transportation Program, which is a federal program that allows us to recoup some of our costs for providing medical care to Medicaid patients. And that program has been a significant revenue source. Also, and that too does not impact the residents directly. And then the next one down, we implemented emergency incident cost recovery. So this is more similar with the ambulance plan, only it's on the fire and rescue side, where we are billing for like vehicle fires, hazardous materials calls, structure fires, et cetera. And again, we're only basically billing in what is accepted or paid by the person's insurance carrier.
Trustee Shetler has a question.
Yes.
Just out of curiosity, what happens when you pick somebody up who does not have any health insurance?
So though, if our billing company has that information, they would, and they have a residence that they could be billed to, they would be billed. If that person has the inability to pay, they contact the fire department and we waive that cost. And that's not unusual at all. We have a system in place to manage that. It's not our goal to, if I would be glad to just, not have to bill anyone, but if there's a cost of doing business and it's significant. As part of the ground emergency transport program, we have to do a serious or comprehensive audit that our finance director works with us on each year. And that determines what it actually costs, the cost of doing business, so to speak, for providing the ambulance service. And it's about $3,000 per transport. So it's significant. When you think of all the training, all the equipment, the staffing, salaries, pension, all that. And then moving on, so we also have been very aggressive in pursuing grants. We talked about the SAFER grant already. We've also been successful in some other grants for equipment. And then we also work hard to try and recapture money for training each year. So all together, with the revenue enhancements we've done, we're netting more than $2 million annually, more than we did 5 years ago.
We'll go back to 2 months later, man. What happens if you don't get the SAFER plan yet? We have to then incur the
That's
cost.
that $500,000 a year cost to continue funding those positions if we have to fund them on our own, as I read that.
Right, so it would have to be built into our budget then.
That's correct.
Okay, and this is a renewable grant?
So we determine what we feel our eligibility would be each time a grant, no matter what the type of grant, we'll kind of look into and evaluate whether we think we'd be eligible. And then if we think we might be, we'll go after that grant and pursue it. There's currently, with some things that are going on right now with there's no funding right now. But there's supposed to be a release of the FEMA SAFER grant soon. And we're already prepared. We've already been working on that application. So we will.
That's for new employees, not current existing employees.
That's correct.
So it'd be for 3
A
days.
lot, that's what happens with grants, that they don't necessarily fund the second time. Okay, and then I would assume in the budget, I'm prepared for the fact that you don't get it, you start to use it cycle.
So that's where we'll need to come up with those revenue enhancements.
Okay,
It's part of the package.
All right, so that's kind of all touch base on that now. So with strategic planning that we've been doing, kind of just to kind of step you through the process. We completed a community risk assessment. We basically determined the need to retain more paramedics in the village. It was very supportive of that. We did institute the ALS fire apparatus, excuse me, which has been highly successful. But we do feel that there's still a need for that 4th ambulance. If approved, then the next step would be to purchase the necessary equipment, which would not necessarily be a lot. We currently have 6 ambulances. We don't feel that we would need to increase the number of ambulances. We would, instead of having 3 3 reserve ambulances, we would have 4 frontline and 2 reserve ambulances. And that ambulance still would have to be, budgeted for, because now you have that, you'd have to replace that ambulance more frequently, because you're gonna have more time on the ambulance. So there's still a cost to that, but it doesn't stand in the way of us moving forward with the 4th ambulance. Our proposal would be to phase in a 4th ambulance during peak hours. Eventually then increase in staffing by 6, that would provide 2 more additional paramedics per shift, staff an ambulance. And then eventually, and then at that point, be able to implement a full-time 4th ambulance. So that might be, 2 years out or 3 years out. We'd like to see the phase in sooner than that, if possible during peak hours. And then the next chart down kind of indicates kind of the peak hours, and you kind of see basically 7, 8 o'clock in the morning till about 6, 7 o'clock at night is when we're at our busiest. And that's pretty consistent throughout the week. And then the last slide here talks about like the strategic planning process for the new fire station. So again, we did that community risk assessment. We've been evaluating needs. The current station is not only old, but it doesn't adequately handle our equipment any longer. Apparatus are obviously bigger than they were back in the 60s. An ambulance back when that station was built was literally a Cadillac station wagon. That's what that was, the ambulance. And so you can imagine now what the ambulances look like today, and how it's much more difficult to shoehorn that into the station than that was back then. And then so along with that, there's one of the things that we try to do is convert our ambulances from diesel to gasoline, and go to pickup chassis style, which is a little bit less costly and easier to maintain for our mechanics. But those vehicles are a little bit longer. And so we literally right now, we can't put that type of ambulance in Station 18. And so it's kind of holding up our ability to change that ambulance over to that pickup chassis style. Next step would be to evaluate response data, which we've already been working on. Evaluating the optimal location, which we've been working on. And then the land acquisition. So I think, that's really up to this board to kind of determine. I understand the cost of this venture. But that's kind of where we're at, we make that commitment, whether the village moves forward with supporting the land acquisition. And then from that point, there would be a point where we would interview architects and or design professionals and secure RFP for a contract, and then same thing for a general contractor. It's important to those can be lengthy processes. You want to make sure that you get the right professionals on board to really control cost and make sure the finished product is what serves the community and the department best. That's my report.
Trustee Purcell, sorry, it's not in your report, but I'm curious. I asked you this a long time ago, Chief. There's a organization in nonprofit called South Chicago, it's an EMT service, and I do know that they do come to Skokie. Recognize, I know they do medical transports all the time to hospitals. Does that help our burden at all? Has it been in a way, or is it hurt?
It definitely doesn't hurt. We have a great relationship with them, and they'll call us from time to time where we'll all show up first. They were called by their resident that.
Right, somebody.
Right, and so, but then they determine that they need a higher level of care that they can provide, then they'll call us. But we have a great working relationship with them, and I'm sure there are some times where they transport patients that then we don't have to transport. So it does, at that time, it does take a little bit of that burden off us, for sure.
Because I do know in the Ridge area, I've used to do numerous times, especially on Friday night. I'll see a hot cell on doing that, the fire department, I can get, I was wondering how, if you felt like that was a burden, or if that was helpful.
Yeah, it's definitely not a burden.
They've been a good partner to the village, as I've seen, especially during our response to the COVID-19 pandemic. They were an important partner in the vaccination clinics and so.
Absolutely.
Thank you. Trustee Shelton.
Yeah, where are, this is a point of information, where are the three current ambulances housed, where are they going from, and where will the fourth one?
So right now, there's one in each of the districts, one in each station, so ambulance 16 down at the headquarters down at Mass Center. Ambulance 17 over at the new station on Central Park, and then ambulance 18. Excuse me, station 18 is right by Public Works, 9024 close.
So if we have to use the new ambulance,
But it would be dependent on, if we were to phase it in, we would try and have it in the 18th district, add station 18 during the day, during peak hours. If we're building a new station, then it would be factored into the new station, whether we run two ambulances out of the same station, or if we kept station 18 open and left one ambulance there and then added an ambulance to the other station. But it makes sense to have that fourth ambulance in serving that district. Not that they all serve the whole community, but when those calls come in, it's important to have the closest unit get there, and most likely that's gonna be, thank you. Most likely that's going to be in that district.
any other questions for the chief? So. John and Nick, anything? So John and I have had some discussions over the last few weeks.
There's a ban on, in this year, sometimes it's a little hard to do, and I'm old.
Sure. So John and I have had some discussions over the past few weeks on some creative possibilities for funding the new ambulance. Not ready for prime time yet, but stay tuned. More information on that will be forthcoming. We've also talked about these possible site locations for the new, possible new station. That would be something that I believe we could discuss in closed session at some point. So stay tuned on that. Trustee Robinson.
I just had a comment for the team before they left. It's just, again, to reiterate to your team, the amazing work. I saw firsthand, I mentioned this, at one of the board meetings. CPR being performed on a resident. Pretty scary for a lot of people running around. But the way that your team collaborated with, Skokie Police to secure the area, to provide medical care and attention with care, because, that person is with, their family members, it was a sight to see. So it was truly a heroic moment that I was proud to see you guys. So,
Thank you, Trustee Robinson.
Thank you for sharing that, Trustee Robinson. I think the other great piece of information we have, and this has been consistent since 2003, that anytime the village conducts our community survey, the ratings for the efficiency and effectiveness of our fire department are always among the highest that come back. And again, that's been consistent every time we've conducted that survey, so every 3 years since 2003. So that's on to you. Good job.
Thank you.
Can I mention one thing?
Please.
Yeah, it's my, thank you there. I think that a lot of people don't know where to keep in their home a DNR guys to find it. I think from a comms perspective, that would be helpful, and that was a journey, unfortunately, I had to learn. Not been any rest in peace. And I think when you come into a home, if the primary caregiver's not there, you're gonna automatically resuscitate, as I understand. That might be something we should think of to talk about as a village to help people. So I learned in or whatever, right? So I think that would be an educational piece that we could talk about from a common village safety, first responders, just not like this.
We also have a live file program now that you can actually get all that information gathered, put it in an envelope, put it in your freezer or wherever else it might be appropriate, but freezer works. And then basically that gets communicated, that can get communicated to us, and we actually have it on, in our records, and we'll know to look for that. So that when the call comes in, it's tied to your, that particular address, and we know that that file exists, and know to go to look, please, or look
They
for
have
it.
anything else, I think this would be a good way for us to inform our, the. Great
I
point.
recently received a questionnaire to upload a lot of this information
Mhm.
here. Village, which is.
I'll say that I did it
Yeah.
all, yeah.
Was that through the Smart 911?
Yes,
Thank you.
Yeah.
it was smart.
Yeah.
Yeah.
So perhaps that's another way to get it out.
Yep.
Well, hopefully we can get more buy-in, the.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everybody. You know,
Does anyone need a quick break? You do, go ahead.
You'll be okay.
If you want to move it, you're welcome.
Someone bring
Say, take a quick break. Yes, go ahead. Thank you. Waiting for trustee Shepherd. Okay. The next item on the agenda is the presentation of the police department budget by Police Chief Jesse Barnes, who is joined by Deputy Chiefs Denise Franklin and John Oakley, and our Communications Director, John Barkley.
Thank you.
Sorry, page 69 in the budget message and 277 in the budget detail.
Mayor and trustees, thank you for having us this evening. Pleased to be here to present this proposed budget to y'all. I wanted to start by thanking all the members of our team that put this together. They put a lot of work and research into this, and I'm proud to report that fiscal year 25 is a year of progress for the Skokie Police Department. Our commitment to safety and community engagement remains strong, and the results reflect the hard work of what we consider to be our most valuable asset, and that is our people at the police department. During fiscal year 2025, we promoted 4 officers to the rank of sergeant and promoted 2 sergeants to the rank of commander. During that time frame, we also hired 10 new police officers. The training and mentoring of all these people in their new roles has been a priority in fiscal year 25 and will continue to be in the next fiscal year. Still, one of our biggest initiatives continues to be recruitment and retention. As we know, nationwide, we're facing shortages of law enforcement candidates, and attracting, training, and retaining high-quality officers is absolutely essential to maintaining the high standards that the community expects and deserves from Skokie Police Department. Over the past year and continuing into the next year, the Patrol Division has implemented a comprehensive traffic safety initiative, which we are focusing on reducing serious accidents and enhancing public safety. Key strategies include increased officer visibility, data and community concern-driven enforcement in problem areas, and continuous evaluation of the effectiveness using both data and feedback from the community. The last year, we've responded to approximately 40,000 calls for service, providing timely professional assistance while continuing to emphasize de-escalation and increase public trust. Worth noting that in that time frame, our co-responder program handled 377 citizen interactions without a single use of force. On the administrative side, we're pleased to report that we have successfully replaced 14 fleet vehicles over the last 12 months. This comes after years of delays in the supply chain, creating serious challenges in us obtaining and outfitting new vehicles. We feel that we're finally bearing the fruits of several years of work on that, and that helps to ensure that our people have reliable equipment to respond to emergencies. With the approval of this budget, we hope to continue down that path and successfully replace a total of 28 vehicles since we started actually receiving the vehicles from several years back. We've also made significant investments in our workforce by logging over 26,000 hours of training, on average over 240 hours per officer. Many of those Illinois Law Enforcement Training and Standards Board's mandates, but much of it is also other specialized training we find to be absolutely imperative to our officers, just crisis intervention training, juvenile certification, and various other topics. I believe this helps to continue to demonstrate our investment in professionalism and career development. On the community engagement side, over the last year, things have flourished through Cops with Kids, Cops on a Rooftop, which will be upcoming in this week as well, National Night Out. And this year we actually had our 42nd iteration of the Citizens Police Academy. With that, thank you all for your support, and happy to answer any questions that you have.
Go ahead. Trustee Robinson and then Trustee Schechter, and then I'll go.
Thank you, Mayor.
You're up.
Had a couple of things. First of all, the fleet vehicles, good stuff. I know we've been talking about trying to get more vehicles. I did notice that the budget is down $70,000 in gasoline, just 22, 23. And I also wanted to mention that I appreciate the 377 respondents to the code response program. And I hoping that that can be expanded to the weekend and night hours. And wondering if you put that into the budget plan. Because I want to be able to support.
So we haven't put that in. We have not put that into this year's budget. Our focus has really been trying to get staff out into those patrol vacancies that we've been trying to fill for the last several years. So that's just the priority right now. Obviously, you know, the co-responder program has been wildly successful. I think all stakeholders, all angles are in agreement over that. It's an incredible resource. We rely on them, you know, regularly and very supportive of that program. It's probably the only program in the police department that I've ever seen absolute support from all stakeholders, all angles, internal, external, outside providers, mental health professionals, communications, fire department.
Perhaps there's a way to do it in concert.
Happy to have those conversations.
Chief, to expand that program, we couldn't do, if we had to pick expanding to evenings or weekends, which would you choose if we couldn't do both?
There's benefits to, and there's probably benefits and setbacks to each. So, part of when we made the decision to structure it with the hours that we have it currently structured at,
Is it 9 to 6?
it is roughly 9 to 6. Yes. So, and obviously, if things come up outside of those hours, they work later, they come in early, they stay late, they're very accommodating to the needs of the population they're dealing with. But one of the things that we thought was important was for them to build relationships with other providers that are working in the mental health realm. And it's important to be working when those places are open. And it's also, if they're doing linkage with wraparound services and such, having facilities that are open where they can handhold and do a pass off to somebody outside of just an ER, which would obviously be 24/7. We thought it was important for them to develop those relationships and to be working when those places are open for service. So the additional hours, people struggle with mental health crisis at all hours, all days. I mean, law enforcement operations being 24/7. That's why we have prioritized trying to get as many of our people through crisis intervention training as we have. We feel that, you know, our officers are obviously able to de-escalate situations when they have that additional training. So it's more than just having that unit. It's also educating our entire workforce on what it is that co-responders are doing, what resources are useful to them. And they obviously share that with our officers too. And when they're out there interacting with our officers on calls, our officers are learning about different resources that they use. And then that's kind of a tool in their tool belt if they are in fact dealing with the situation outside of the hours that they're there. And the other thing I'll mention is that in our business, we understand that it's not like you just go home and your phone doesn't ring. So if there's somebody that says, hey, you know, I've really established a good relationship with your co-responder, I'd really like to speak with them, you know, sometimes we can try and do some outreach and see if we can have them do some communication with that person outside of their normal hours as well.
Chief, I have 2 questions about crisis intervention training. What percentage of PD staff would you say are currently trained, have gone through this?
I'm not up to date on the exact numbers, but I believe it's more than 65% of sworn.
And I remember, you know, before I retired, that it was difficult to get this training.
That's correct.
Is that still the case?
Well, they're actually they added it to the basic curriculum of the police academy. So when we send people through the police academy, they come out certified in, it's not the advanced, it's the basic, right? Basic. They come out certified with basic crisis intervention training, which helps, right? There was an issue during COVID, a lot of police training got canceled. And obviously that was a class that came about a few years before COVID. So there's a little bit of a backlog of we're all fighting for the same seats in the same classes. Certainly our facility allows us to host those classes at times, and we do take advantage of free seats in the classes when we do host. So that's been a resource to us as well. And you know, considerations, it's not as simple as sending everyone at once. You need to make sure that you have the resources on the street to protect the community. You can't have everybody in training at one time. So we try and space it out.
Thank you. Trustee, oh, I'm sorry, trustee Schechter, then back to trustee Lawrence.
Yeah, I have a whole lot of questions, so a lot of it, just so you know, and I won't ask them all at the same time. But a lot of my questions really revolve around the extent to which a lot of what the village does can benefit from collaborations across departments and synergies, because I see it, for example, I see a lot that relates to youth that is in the corporation counsel's office, the police department, health.
Sure.
So, so if I just, let me just focus on youth at that point. Like what, and I saw the community resource officers that we have, and that's about $250,000. Is that all the village, the school districts are not helping to pay for any of that?
No, if you look, the school districts do pay a portion of the salary of the school resource officers. District 219 does contribute to that, through
About what
supplemental
percent?
funding. Is it? I want to say it's 70 something percent.
It's right at 70%.
And how do you, does your youth sort of interventions work with some of the other departments, like, say.
Sure.
So, I'm gonna help you. So, Anne Marie Benuzzi, who is our youth outreach coordinator, she has an office at the police department.
Correct.
But she is also, part of her salary is paid through grants from Health and Human Services. She will coordinate with the school resource officer and the school with regard to citations that may be written for the next court date. She and I will sit down prior to the court date and we will go over the cases and figure out what we believe is the best recommendation to make to the judge with regard to each of these juveniles. She will make an effort to reach out to parents and discuss these options with them or recommendations with them. So there's more of a united front going before the board or before the judge.
And what do we do to, in terms of prevention or like I guess I would be, I don't know whether that's you, John, but other parts of the village to sort of prevent issues with young people from getting to that point where it's going to.
So sometimes there is like multidisciplinary meetings. Our school resource, obviously, officers are a great resource. They're kind of boots on the ground in the schools. They're seeing trends that are happening with teens in the district. Usually before we might see them in the patrol division. They hear a lot, they are in the schools. A lot of what they do is positive interactions or community engagements with the students. They're kind of a friendly face in the hallways. Obviously, safety and security is important to them as well. But they are not patrolling the hallways, trying to look for students vaping or something like that. That's not their role there. Certainly they work with the administrators within the schools. There's a lot of collaboration between school administrators, school social work staff, and our SROs, and then also Anne Marie and legal as well. So there's a lot of that goes on. There are also other meetings such as like youth coalition meetings and such to try and get a lot of different perspectives in the room on patterns, trends, what we can do, education. The example I'll give is I don't know if they did it this year, but in the past, our school resource officers have actually done some education in the driver's ed program at the high schools, where they've kind of done a mock traffic stop. So that these children, the first time that they get stopped by a police officer, if they, are stopped for a traffic violation, it's not as scary to them. They understand what the officer is thinking and what the officer needs to accomplish, but they also get that kind of mental rep of, okay, this is what I should do. I should have my license ready. I should have my insurance card ready. Roll the window down all the way. Those simple things that the education piece is helpful for that. And then, other things that come up in those classrooms would obviously be motor vehicle crashes and such as well.
And switching gears to the neighborhood integrity programs, I just wanted more of an idea of some of their statistics with regard to what the neighborhood integrity officer has some of their comments.
Sure, I can't cite statistics, but I can get you whatever you need. We could follow up on that. Program has been, I believe, an incredible tool to educate all parties involved. Whether it's landlords, a lot of our landlords are essentially, some of them are operating businesses within our community if they're owning properties. And obviously, we want to make sure that people operating businesses within our community are abiding by, rules, regulations. Some of them are doing this as a passive additional income. They are not full-time property managers. They're not full-time landlords. So in those situations, it's important that we educate them so that they are not violating their tenants' rights, and also so that they are aware of, if they're not living on site or maybe they have multiple buildings, they need to be aware of things that are going on in their buildings that could be problematic to the other residents in the building.
And do you know, like, how many citations?
May I just jump in? If you know that off the top of your head, please. We are going to have a presentation at our June 4th board meeting about the neighborhood integrity ordinance.
Oh, we are.
Yes, we are. So, yes, so my hope is that some of that data can be presented to us during that presentation.
Well, I think if there's specific questions, if we can get those ahead of time, we'll make sure that we have answers to as many of them as we can.
Yeah, I mean, just, right, there is the education piece, which is the, what is it, SEPTED or whatever that you do. But also, to an extent, and I guess it would be also with, again, like I say, synergies with community development and inspection, property standards. The extent to which things are getting better, that you'd say, whatever, crime calls or.
Sure.
Especially the. Getting a sense of how. What are the criteria that you're using for effectiveness?
There's a brief comment, I hope, from one of our residents.
I can one thing.
Go ahead.
By way of introduction, I moved into Skokie with my parents in 1965. They're still living at Kenneth and Birchwood. They're 89 and 91. My brother's a retired police commander in Evanston. He lives in Skokie, and I live with my wife in Timber Ridge. One of the things I would urge the board to do is look at police staffing numbers. I'm not gonna, drill down too deeply, but what I would start out to say is the village for quite a while, dating back to March of 2014, did a study that was actually done by an organization for the village and reported back in 2014. The bottom line for that is it recommended a staffing level of approximately 122. Fast forward to a story I pulled off of online in 2019, and we were at approximately 115 then, trying to get to 122 was the aspired goal by leadership back then. I get we're in a complicated budget time, and I get that resources are tight, but if you drill down into the current budget, we have 2 frozen positions. My short-term approach to the board and everybody else would be unfreeze the 2 positions. I understand that there's a gap right now between current staffing and, those 2 positions. It's substantial, and even in a good year between hiring, the recruiting challenges and everything else. But I think that if everybody could just, when they have time, glance at the conclusion of the study and if we can make an effort to try and get the numbers up, because we can be more innovative on domestic violence, we can be more innovative on co-responders. We can go back to putting 2 people in a car. I've worked for years with most of the 120 something different suburban police departments. This one, hands down, is literally one of the best. And last but not least, when you get to the closed sessions and when you look at individual compensation, as a member of the public, we're not privileged to be in on those, rightfully so. But I urge you to talk with the village manager. And one of the things I had to do that I did in sort of getting a sense of where we were is I started pulling salaries. And we are lucky to have this management team in this police department. We're lucky to have the rank and file. They're absolutely terrific. But if you take a minute or two and you look at the recent salaries of the Evanston police chief, the Evanston village manager, and I'm using the chief by example because as hard as I drill down, there's a substantial gap between what we're paying and what they're paying. And then if you look at the comparables that the village typically uses and agrees they're similar for union negotiations and salaries, and you look at other suburbs and you can pull it one at a time, one after the other after the other. We can do better, and I hope in time we try, and I think they're worth every penny of it.
Thank you. Trustee Robinson.
Thank you, Mayor. Just a couple of comments. Trustee Schechter brought up some things, and I appreciate some of the responses, the collaboration. Of course, I was thinking the Youth Coalition call, Land for More, which is that wraparound services, so that's definitely something like that. Definitely, wish that the training piece was better. I think maybe we can do spicy goals. I don't know if there's measurable goals, throughout the year, maybe 65%. Is relative. It's a B, if I'm grading it, in school, which is not great. So I think that aspire to be better and do better as a collective department. I think our community deserves a little better than B average. Additionally, I heard you say to the practice stops, and I know that's a collaboration between the two. Careful of more harm than help. Because I understand the goal of that, to try to get students prepared for that. There could be some unintentional harm with that, so just please keep that in mind. And I know the youth court calls have always been a great support, but I know it's in practice is a reactive measure. So looking, I guess my idea is about some more proactive stuff. So just trying to think about how you proactively engage, especially could be another discount goal that I can wait to kind of look around with some folks in the future. So those are just some thoughts.
Thank you.
Thank you.
Thanks.
Yeah, I just wanted to rise in support of the gentleman's comments about police headcount numbers as, we could use that help. Addition, several years ago, a decision was made to move the animal control department from this building for a wonderful woman named Maggie to run it to the police department. The service levels have declined so much that it's no longer an effective service. That's almost non-existent. They've had a barking dog at the Beaver to us for several years. Maggie promised us we would be taken care of and the citation would be written in the next visit. Years have gone by without that occurring. In addition, there's large numbers of crimes, white collar in nature, mail fraud, et cetera, that aren't being investigated currently. That need, there's need for additional resources to the investigations unit for things beyond the everyday headline grabbing things that affect quality of life.
Chief, I have a question. To Trustee Robinson's point about the 65% level of training being at best a D on his grading scale, what are the biggest impediments? What would it take to get from that grade to a D?
So I mentioned the staffing piece, right?
Yes.
Not everybody can be in training at once. There was a lot of law enforcement reform legislation that did a lot of good things for our job, but it certainly lobbed a ton of unfunded mandates of training on our profession. We have a ton of certifications that are on an annual basis, on a 3-year basis. I think it's 5 years for some of them as well. Those could deal with things like investigating sexual assaults. It could deal with being a lead investigator on certain types of violent crimes like homicides, CPR, AED certification, things that are all, our officers are out there doing a ton, right? We are who people call when they don't know who else to call. We have a ton of equipment that we are using. Some of it is to de-escalate situations. It all requires training and certification. I just went through last week or the week before our less lethal training for our tasers, our 40 millimeter less lethal projectiles, and our range training tactics. These are things that we have to work all of this training in. If you look back to 2012, we probably had as an agency a third of the training that we currently have on an annual basis. And that is the equation of how to get everyone through training, but still keeping the staffing to the levels where every day we have what we need to respond to emergencies. It takes a lot of work.
Thank you. One comment. Oh, go ahead,
Just
Trustee
really
Robinson.
You guys are doing great work, and I definitely don't want to minimize the work that you guys are doing at all. Do you guys have like folks on staff that are like trainers?
We do.
Okay.
We do.
Okay, beautiful.
Yep, and they all have to be certified through the Illinois Law Enforcement Trainings and Standards Board. Their curriculums are submitted through there. They have to be approved by that. They are all in addition to whatever their primary responsibilities are, and our training officer is the one tracking all of those mandates and certifications and making sure that we are all up to date on them.
I know it's a lot. You guys are doing a lot, so we're great.
We're proud of, I mean, the level of training that we have is incredible. We have instructors in just about every topic you could think of. Happy to put together a presentation on that sometime too, if you'd like.
That'd be great. Would that be something? Yeah, let's put that at one of our July meetings. John,
I just wanted to mention in specifics to the CIT, the crisis and training officers. Having 65% trained allows us to deploy those individuals when the call necessitates it. And so there is judgment being applied and actually criteria within the 911 dispatch center that when the criteria presents itself, then a CIT officer can be dispatched. And so the 65% is 65%, but we're also able to deploy those resources. So I just wanted to add that to the conversation.
Trustee Schechter.
Just a question about some of the data that the calls that you get. I mean, I didn't see domestic violence here, but what percentage would you say?
So domestic violence, a lot of that would fall under the assault realm in our statistics. It's kind of a subcategory. And the way that those stats are put together now is based on the FBI reporting standards that we have complied with the last couple of years. I couldn't give you a percentage. Yeah, I mean, I don't think that it's really feels any different. Like it hasn't really increased or decreased. It's always just kind of been where it is. Those are certainly calls that require a very specific response. You know, that would be a 3-car response to a domestic violence situation, minimum 3-car response.
I asked the question because I'm block captain and you said very loosely, because I know I could probably do a whole lot more. But when we had our officer, our liaison, and he made a presentation a few years ago, we made my house in the block, that was like #1. You know.
So we do have Julie Kim is a victim advocate social worker. She's been a long time employee of the village. She works out of the investigation section. Any incident of domestic violence, investigation supervisors are forwarding her the police report, and she is doing outreach with victims, witnesses, making sure if they need additional services. She has helped people navigate the court system for orders of protection, tried to link them up with referrals to other outside services, whether that's domestic violence shelter or whatever it is that they need. So she reaches out to all of those people, and she's very busy. We've kept her busy. She's incredible at her job. And to your point about collaboration before, she sits in that domestic violence court call. She knows all the people in the courtroom. She knows the state's attorneys, the public defenders, the judges, the victim services, social workers. She knows everybody, and those relationships matter to trying to meet the needs of those victims.
And there's not too much work for her. In other words, you don't need another half a person.
Oh, she's managed that very well. And there are times we ask her for help with other victims of violent crimes, or if there's a particularly egregious crime. I mean, she's helped out like the co-responders have over the years. If somebody has lost a loved one under traumatic circumstances or unexpected circumstances, we've certainly sometimes reached out to them and said, hey, can you come over here, accompany us to do this notification? A death notification is a tough part of the job of being a police officer. Going and telling someone that their loved one has passed away is it elicits a different response every time from the, everybody grieves differently. So certainly the social service or social work element is helpful in those situations as well.
We're very fortunate. The three social workers that have been named tonight, Brian McHugh, who's part of our co-responder team, Anne Marie Benuzzi, who works with the youth court call, and Julie Kim have all been on staff for many, I mean, the collective experience of these three is outstanding. I would encourage any of you, if you've not done it already, consider, as your schedule allows, attending a Niles Township Youth Coalition meeting. You can, I encourage you to check in with the village manager, but just to go and sit in on one of those meetings. They used to be held, are they virtual now? Do you know?
I think it goes back and forth.
They used to meet at the District 219 Administration Center. But that would be something I'd encourage all of you to attend, just so you can hear the discussion between the government entities, the nonprofits, service providers, and the schools. And then also the youth court call is, again, you can check in with the village manager, he, knows the schedule, but as I mentioned the other night, I sat in on one of those early on during my tenure, and it was extremely valuable to see what goes on.
You can call me and I'll give you the schedule when they are district.
Yeah.
Published.
Any other questions for
Yes.
Chief? Yes.
So, many municipalities have the issue of the backlog of rape evidence collection. That's, so my question is, does Skokie have a backlog? If so, what is the length of that backlog? If not, what is the time frame from when evidence is collected to when it can actually be processed and be useful in the investigation?
We do not have a backlog. There's some legislation that passed, I want to say probably 4 or 5 years ago, which addressed some of that. Our property and evidence division is incredibly timely. Certain things go to the state lab, certain things go to a private laboratory, but we are able to get evidence where it needs to go very quickly. It's not an issue. Sometimes the only holdup on some cases is if evidence is collected from another agency, like if the victim of sexual assault can go to any hospital anywhere, and they might not disclose exactly where it occurred. And we might learn in the course of that subsequent investigation that the Chicago Police Department collected evidence, but that the actual incident occurred in our town. In those situations, we have to work with their property and evidence in order to obtain that. That could slow things down sometimes a week or so, but we don't have like a stack of kits that have not been submitted.
Very.
Any other questions for the chief? Thank you.
Thank you all.
Thank
Appreciate
you.
your time.
You're excellent. Appreciate it.
Yes. People get highlighted things.
Is it five?
I met your son a few weeks ago and your granddaughter. From some political side of it. So. And the granddaughter. They were talking about political science.
Yes.
Oh, she.
Yeah, to come home from school. We never got some. It's all good.
No, he was great. They were great.
No, it's not good. It is a lot, however, the nice thing about, I mean, I don't slow them up. Right? I hate that sense of just, oh, you be able to search.
Yeah, that's what I just.
Awesome.
When you want your.
I
mean, there's.
Well.
Okay. We're ahead of time. I just put out a jinx, didn't I? Sorry, everybody. Okay, the next item on our agenda for this evening is a presentation of the Public Works and Capital Improvement Program budgets by our Public Works Director, Matt Slanker. He is joined by his staff. Let me see, Engineering Director Russ Rietveld. Brad Magi, help me with your title. Operations, Liz. I'm about to give you a promotion, I think, our Assistant Public Works Director, Assistant to them, somewhere.
Good either one.
Your senior engineer, similar to Maximilian. So, with all that said.
That's good. I wrote all their names down just in case I
Just in
forgot them.
case.
So
And we're
not in case you forgot it, in case I forgot.
We're gonna start at page 72, in the budget message, page 323 in the detail. And then when we get to the capital improvement program or CIP, we're on page 93 and 490 respectively.
Good evening. Thank you. Good evening, everyone. Good to see you all again. If you're looking at the budget summary page, Public Works General Fund budget increases this year by almost 2.2% or $300,000. As you'll see noted in there, some of the items of expense relate to the increase in the recycling contract expenses. And then I think the majority of the story beyond that from an operations expenditure standpoint relate to increased parts expenditures and the automotive division. That really sort of tells the story of what's going on from an operating standpoint and broad overview. Things that we want to focus on tonight and that we will run through really relate to expenditures in the water fund. I know that there's a memorandum that's signed by myself, Finance Director, and Russ relating to water fund projections that was included in your packet. So we want to spend a little bit of time and walk through that this evening. It ties to some of the principal themes that were included in the budget overview that you received on the first night in terms of what are the significant short-term budget issues facing the village, those being state and federal mandates and the related expenses that arise from at least one of those. And then some of the short-term spending challenges for the village's water system and what those challenges look like forecasted forward. with an ultimate impact on projections for the water rates. Also relating to that subject matter is the work of the Stormwater Task Force, which I think we visited with most of the trustees, and then last year, I think we visited with that village board as well with respect to the Stormwater Task Force's work. We'll want to spend a few minutes on that. And then we'll give a little bit of an update on electric vehicle transitions in the village fleet. Talk a little bit about solid waste and parkway tree planting, and then we will stop and try and allow plenty of time for Q&A for whatever is on the trustees or the mayor's mind. So with that being said, we'll jump into the water fund memo. So I think the most significant in the short term thing that's going on with the water fund is lead service line replacements that are mandated both by state EPA and federal EPA. So the state law in that regard took effect on January 1st of 2022. And for those of you that are in the room, and I'm sure hopefully most people in the community are familiar with it by now, but a ban on partial service line, lead service line replacements. And so Skokie is in the unfortunate position of having about 11,000 or so lead service lines. Now, the first iteration of this legislation at a state level would have given Skokie approximately 34 years to abate all this lead in the system. But when the issue became, I will use the expression, federalized in the last year of the Biden administration, it moved that timeline up to a 10-year compliance period, which greatly alters, of course, the financial outlook for us to come into compliance on that. So that 10-year timeline now appears as if for us it will be something more along the lines of a 15-year timeline or a 17-year timeline. But the point in making that comment is we don't know yet what that timeline looks like exactly as we sit here today. But nonetheless, we do know what that expense looks like. We just don't know over what time period exactly we will be seeing that. So that is certainly a significant item of exposure in the village's operating outlook and as we forecast forward for the water rate. So I'm going to turn it over to Russ to dive into some of the details for our spending in that regard and balance of the water fund for FY26.
Good evening. So as Max alluded, the legislation on lead services was initially put into place by the state, and then it most recently got ramped up by the federal government. And so, as Max alluded to, we qualify for the deferred deadline, but we don't know how long we're going to have. But the legislation says that we need to replace no less than 688 services a year. And so that starts in calendar year 2027. And so all the figures in the proposed budget account for that beginning in FY27. That's why there's a sharp increase in costs from 26 to 27 under lead lines. In FY26, we're planning to replace services with our water main project as we've done the previous 2 years with great success. And then we also have, we obtained a grant from Congressperson Skokie. And so we've been working with our consultant and the US EPA to get that grant. And that $2 million will go into just water service replacement, just lead service replacement. The other big items in the proposed CIP regarding the water fund and infrastructure is our water main replacement, which we're proposing to replace 1%, 1.7 miles, but then gear up to 2%, 3.4 miles by FY30. And so that's all projected and detailed in the water fund memo. Is there anything else I'm getting on lead? Of stormwater?
On lead, I would say no. I would just note that, in 2023, the village board did approve the resident cost share program that capped residents' exposure to cost for a variety of circumstances that might happen to a homeowner if they experienced a leak and therefore had to complete an entire service line replacement. which I think has been a well-regarded, well-received program in the community. It caps the resident's cost at $3,000. It finances the resident at 1%, should the resident choose to do so, and floats the resident that financing for 15 years, I believe, Julian. So it's been a well-received program on the part of the village, and I'm glad we were able to offer that. We will need to look at an adjustment factor to that cost sharing, or potentially consider an escalation of that amount at some point in time, but
Like of CPI,
yeah.
something like that.
But I think
Yes.
the thing for us.
Sorry. Finish, ma'am. If a person doesn't have an issue, like you said, when someone has to replace, then they find it, then they replace it. What's going on with residents like me, who haven't paid attention yet to it, and have not even looked to see if I, like, full disclosure to everybody. Have you been getting any calls or inquiries of, well, like, you want to catch it, but you've been great about telling everybody what we have to do, as far as the future, what we have to complete, so curious what the calls are.
We, I think our intention when we created the program was to try and think of the situations that would come up where, I'll put it this way, where a resident has a problem thrust upon them. Because that would either be when the village has a leak on its side of the service line, it triggers that resident to have to do something on their side of their own property, right? Or conversely, when a resident experiences a leak issue on their side of the line, the whole service line has to be replaced. So the whole focus of the program was on trying to help a resident who's all of a sudden in a financial crisis, has a leak issue, or gets the knock on the door from the village saying, bad news, you have to do this and you have to do it now. The approach we took in the program situation I think you're describing is the resident who self-identifies, who says, hey, I just want to replace my lead service line. And I think that at that time period, we were of the mind that, residents who self-selected could probably be in a position to better manage their own resource and pay for it. Not saying that doing an entire lead service line replacement is inexpensive. So do we get calls about that? Sure. The village will need to be moving forward with planned lead service line replacements. So over some period of time, obviously, as Russ has said, we will see a ramp up in how many service lines we're doing. And so it's most efficient and maybe most cost effective for us to do that in an organized manner, but it's going to take some period of time for us to do that. So if there's a desire for us to expand that program to capture those who self-identify, that's something we can consider.
It might be also helpful to remind us all about what's applied to the water of the plant and ensure that the lead doesn't leach into the water.
Yeah, so there's a phosphate has been applied as part of the treatment process in Evanston for many, many years, which is a lead protection, if you will. The intention of phosphate being introduced in the treatment process is it provides a coating to the inside of the lead service line, which inhibits lead from leaching into the water. And so that's considered to be an effective control mechanism, unless there is construction activity that disturbs that lead service line, which is why when there is a leak on a service line that needs to be repaired, the whole service line replacement then becomes necessitated. And the other reason that it's required in that circumstance is the concern that when lead and copper meet in the same service line, there's the potential for what's referred to as galvanic corrosion that can lead to an elevated lead level. So, I hope that answers the question. Yeah.
I just have a quick one on, I realized in your memo, I don't think I saw anything about multi-family buildings. To what extent is this an issue in our floor flats, in our,
Yeah, do you recall how we bracketed residential in the current program?
So I believe we encountered some of those on our water main project last year, and ultimately it's a function of the building. If the building has a small enough diameter service that it could potentially be lead, or if the building has individual services, because a larger diameter service is not going to be copper or lead, it's going to be ductile iron, and so that will not be an issue. But if it's a residential property and there's a lead service, then the cost share would apply.
Any other questions? Trustee Robinson?
Let's see that. Any other thoughts about incentivizing residents? Can we get the ball moving or rolling, the lead service in place? Are there grants available or are they?
There is grant funding, so that is. We certainly are and will be in pursuit of that. Mentioned Congresswoman Schakowsky's funding. I don't know, Sam, do you want to talk about the planned replacements that we're trying to put together? And those will certainly, we will target funding for those, so that, come talk about that project.
You can talk about the average cost.
Yeah.
So for the first part, we are pursuing, loan funding. So there are certain type of, loans out there, that the federal government puts out where, it could be either at 0% interest rate, at a 30-year repayment, or possibly principal forgiveness. We have made steps to apply for that, and there are areas in town, that line up with census tract areas where we would potentially get principal forgiveness. So as far as strategy on trying to figure out which areas we're looking at replacing lead service lines first, those are the areas where we're trying to target in terms of replacement for first round. And then rest.
Well, I don't think we're aware of many programs for individual residents to go look for grant money. I know we're looking in all the pots we can for grant funding for our projects. And there is some company that's doing lead service replacement for like schools and daycare.
Yeah, it's called Elevate. They are working individually. They have already been with daycares and high-risk areas in town where they serve high-risk populations to just replace their lead service lines.
What do you guys think the average cost for residential, single family home is? It's kind of the guesstimation.
So it obviously varies based on where the line comes in, and is it hidden in a finished bar, or is it just in a crawl space? But when we set up the cost share, the intent was to split the cost. And so obviously the village gets a better price through our water main project because it's economies of scale. We're doing 100 to 150 services. But I would take, to be more direct and to answer your question, I would say $7,500, $10,000.
So trustee Robinson, when we bought our home in Skokie 15 years ago, we were required to put in a copper line, and it cost $10,000. And that was 15 years ago. So. Other questions? This is a big thing. This is a big initiative. And I applaud staff. And our congresswoman for coming through with that $2 million. But we've got a long way to go. Trustee Robinson.
This is what's geared a little bit.
Yes.
Can we do that?
Yes.
Water main break. Since that, I don't want to say it out loud. What have we done? Kind of ensure that other vulnerable areas within the system are addressed. And just giving a little bit more attention to.
So we are still in the process of conducting the failure analysis, so very shortly we will be exposing carefully other sections of that same pipeline that have those similar sorts of junctions or joints, so that we can complete the failure analysis and have a better understanding of what was the nature of the original incident and exactly how it was constructed, assess those similar joints that are most in the closest proximity, because they also appear from review of our atlases to be the most likely to be very similar to the one where the failure took place of the assembly. So that's the next step in that analysis. And so we hope to have that happening in the month of June. So that's next steps for us. And so we're in the process of gathering the necessary components so that when we do this work, that we're have everything that we need to proceed based on whatever it is we find when we expose it, to effectuate replacements of whatever it is we find. And I know that may sound a little bit unusual, but some of what this is you have water atlases and drawings that date back into the 50s and 60s, and as we know, what you see on paper is not necessarily what you see when you dig it up and you see it. So we have to be prepared for, you know, whatever contingencies we think we will run into when we expose it.
We've talked about the need in advance of any of this testing, very intentional communications to the residents who are proximate to where the testing is going to take place. We don't want people to be surprised.
Right. No, I appreciate it. I know it's all scientific and mathematical and civic engineering and all of that civil engineering. So I appreciate that part of my brain that does not exist, that you guys have. I'll look for you guys to continue.
Other questions? Okay, what's next?
Stormwater. So the stormwater task force, and there's nothing really of import on the public project side of the world to talk about for FY26. You will see in the same memo for the water fund and the water rate, you see information in there about upcoming public improvement projects that relate to stormwater, which began really to become an issue following fiscal year. What we do want to talk about, though, for a brief second, is one thing that does come to life in FY26 is an overhead sewer assistance program. So take it away, Maya.
So one of the recommendations of the Stormwater Task Force was, in addition to implementing 5 public improvement projects, was to create an overhead sewer conversion rebate program. And so first and foremost, what's an overhead sewer? So most homes in Skokie with a basement, it's the photo on the left. The sewer runs down the middle of the street, and then there's a sewer service that runs from the sewer main to up underneath the home. And so if the water level rises in the sewer, then it also rises in that service pipe, and then unfortunately would rise in the basement without some sort of protection. So the intent of an overhead sewer is to totally forego that connection. And by changing the orientation of the piping, you make it essentially a physical impossibility for the sewer to back up through the service line. This provides the most reliable protection when compared to alternative means of protection. And the costs vary based on the property specifics, but approximately $15,000 is average. And so, next slide, please. And so the task force's recommendation to create an overhead sewer conversion rebate program would be to reimburse eligible residents half of the cost up to $7,500. And then it would be available on a first come, first served basis while prioritizing residents outside of a proposed public improvement area. With this being the first year of the program, us proposing the program, we went with $225,000 proposed, which would cover 30 conversions in FY26. And then that would be every year come budget time based on the utilization of the program, we would revisit that amount, see if we need to adjust.
And that's in this budget?
Question. If a resident is living in a service area where we're gonna replace the water main and there's the lead pipe thing, are they also eligible for overhead sewer assistance, or are those programs mutually exclusive? Right.
So I think it's our intention that a resident would be eligible for the overhead sewer program irrespective of their location or any other program activities. Anything else on water? Okay. Gonna give an update on EV?
Sure. Good evening. So we currently have 19 EVs in our fleet, and by the end of FY26, we'll have 33. We've created a fleet electrification plan, and we also participated in a fleet assessment with ComEd to identify the vehicles that we could transition to electric. Currently, we're focused on light duty trucks and pool cars, and we're starting the process of upfitting a couple of patrol vehicles for the police department. We're actively looking at the heavy duty vehicle market. Refuse trucks, street sweepers are two of the ones that we're keeping a close eye on. With that, some of the challenges that present themselves, our current refuse trucks also double as snowplows during a snow emergency. So that's an issue for us, and their battery life will just get us through our routes when the trucks are brand new, and so we don't know what that means 10 years down the road for us. The street sweepers, there is a fully electric street sweeper on the market, but it's mounted on a truck chassis, so it's much longer, and it makes it difficult to get in and out of the cars on our streets, you know, with all the on-street parking. So those are two things we're actively watching. They do also have a hybrid sweeper that is a similar model to ours. City of Chicago just took delivery of a couple of those, so we're gonna stay in contact with them and see how that program goes for them. To see if that's something we could propose.
Appreciate that's double the price of our.
Yeah, it's double the price and you know, minor fuel savings. So really going fully electric is what we're hoping for that technology to continue to develop. It's developing at a extremely fast rate right now. So in the next couple of years, we hope to see something that would work for our operations. So far in our fleet, the implementation of the EVs has been extremely successful. For the most part, all the drivers have been pretty happy with their vehicles. Our oldest EV is 10 years old now. We really only see them in the shop for tires and wiper blades. This 10-year-old vehicle needed an air conditioner, which was the only repair, and that's not uncommon for a traditional gas vehicle. Other than that, we just sort of really are not seeing these vehicles in the shop. So yeah, they've been really good for us. So when we look for new EVs, battery range and battery system warranty are two of the big things that we're keeping an eye on, two of the big factors that we consider when evaluating the vehicles. Kind of move into charging stations a little bit. We have 17 charging ports for our fleet vehicles currently and across all our facilities. And by the end of FY 26, we'll have an additional 23 fleet chargers. We like to have one for all of the fleet vehicles to reduce any range anxiety and just make sure they can be charged at all times. We also installed, this past year, we installed 2 fast chargers at the police station for those patrol cars, so they could rapidly charge up. For public charging, beginning January of this year, we were awarded a charging fueling infrastructure grant. Shortly afterwards, those funds were paused and likely not to return. So we have some matching funds available and some additional funding in this budget year that we want to explore additional public charging sites. There's almost 1,400 EVs registered to Skokie residents. It's almost 500 more than this time last year. So what we've done is we created a heat map with the registered EVs in town and tried to find any public parking lots nearby that we could put a charger in to help these residents with charging. Tried to identify near multifamily areas where there may be a barrier to charging. Unfortunately, there was nothing that jumped out on that map when we did that overlay. So what we're looking at is where are these parking lots that do serve multifamily areas, that do serve some of our ride share communities. So some of those vehicles could be electrified. And those are going to be the areas that we aim to target this year. Our public charging stations currently get an average of about 550 sessions per month with 100 unique drivers. So sitting there for about 4 hours on average. So they've been very successful to this point.
Trustee Schechter and Trustee Robinson.
Just curious about Westfield. I know they have a whole bunch of these charging stations. Do we cooperate with them on?
I haven't had contact with them. I know they have several throughout their property, so I think they're pretty well covered, but we're trying to target the areas outside of where the charging already exists.
We have chargers in the Swift lots.
We don't, and that was something that we originally thought would be a good area to target, but one of the challenges with that is they come and then they sit there for 8 or 10 hours. And so there's not a lot of turnover at those charging ports, and those were not typically what we were seeing, people that were buying an electric vehicle were public transit commuters.
What about the North Swift lot and then the lots that's supposed to be short-term or like kiss and ride by the Oakton Street Station? We
do have chargers there. Yeah, those are some of our oldest. They've been there since we were looking at that today, I think 2015 or even before.
We have there?
Just 2.
Could we use more? Because that serves that multi-family to the east.
Yes, it's an area that we look at and we look at those statistics of how often they're used and if there's any wait list for them. And so, yeah, I look at that quite frequently, and right now it's not presenting as an area that needs an additional charger, but it's definitely easier to add a charger next to one already than it is to put all new infrastructure.
One last suggestion before Trustee Robinson. What about partnering with the participants?
So
Their lots.
yeah, so when we applied for this charging fueling infrastructure, we actually did have a partnership with the park district. That has since gone away. But yeah, it is something to consider.
Trustee Robinson.
I was like, oh, you're all in my head, out of my head. Charging station, public and private, street sweeping, talk about all that. So couple of questions. Solar energy. So wondering about thoughts about public buildings, and solar energy. Let me just throw a couple at you. Divvy bikes and other transportation, method scooters. I know that's becoming a trend. Just thoughts about that, and also electric devices with lawnmowers, leaf blowers, those types of deals. This is thoughts and updates and those types of deals.
I'll take your last one first. The landscape equipment blowers we have fully converted our landscape crew to all electric equipment. Our forestry crew uses a hybrid mix. Sometimes they need more powerful saws and equipment, but we've done it internally. It's been very successful. In part of this budget is a new electric truck to tow this and electric charging trailer that they can tow and charge all their equipment throughout the day. So that's been very successful for us so far, and we'll continue with that. Solar.
Wait, I want to give credit to Public Works. Public Works hosted an event where landscapers could come and see the equipment and use it recently, and so maybe you want to talk a little bit about some of those initiatives to share the knowledge in the private sector.
Yeah, we just we had some staff go around and hand out flyers to landscapers that they would see. We posted information on social media.
Speaking staff to that.
Yeah, trying to welcome anybody, and we hosted a barbecue even so that they can come have some lunch and try out all the equipment that we had. And it was pretty successful. We had anything that they would want to try available.
And we have another rebate out right now as well, which I don't know the status.
I heard from Lisa, our sustainability coordinator, and she said they were all went through within 20 days.
Oh.
Wow.
Rebates for residents to convert to electric lawnmowers and other clothing.
So
Solar, scooter.
I was gonna go scooters, but solar's fine. Solar,
see a lot of,
So there was a significant improvement project. The village hall, the HVAC system had components from the fifties that over the last year, 18 months, has been replaced. The system continues to be tweaked, and so I appreciate the feedback about some of the noise in this room. But in doing that, there is forethought of being able to have solar in the future. And so as we assess our buildings, we assess projects and plan for the future, it's not quite there yet for us, but we're planning for it as we do these.
yeah, because we anticipate that we will have some roofing needs on this building, so the thought was finish HVAC. Look at roofing here. Then in that context. Is it the solar inclusion then for this building?
trustee Bruce Slovan.
Thank you. Remember when we built a new fire department that we need some.
Yeah.
That's not a comment. In the past, when we said in these meetings, we talked about supply and demand post COVID. Even if you wanted to buy the electric vehicle, you know, or even anything that required is like a 2-year wait. Did that change since we're pretty way past COVID now? You ordered something, is it a long wait time?
Our wait times have been significantly reduced, but I would say we're still feeling the effects of that from the vehicles that are in our fleet that have been there too long. So the parts and the repairs that we've had to do on those vehicles. New vehicles are those lead times have been significantly reduced. It's changed. Now you can get the chassis, but then if you need to build a truck body on top of it, that's the long lead time now. So I think we can get a chassis in just a couple months and bodies could be a year or more out. Electric vehicles have been pretty easy to get. Last year we had an ordinance or it was a protocol where we could vehicles that were already approved as part of the CIP. We could get some quotes and purchase directly from dealerships, and that helped us tremendously to be able to get vehicles in very short time.
Thank you.
Trustee Levy.
I have a couple questions about the EVs. For the smaller vehicles, I'm assuming that we get a clean energy tax credit. We would also get one for the larger vehicles, and is that a larger credit?
Yeah, it depends on the class of the vehicle. So yes, both ComEd and not sure where the IRS is with their program right now, but I think a class 3 vehicle jumps up to $30,000. So right now with our smaller vehicles, the light duty pickup trucks and police cars and admin vehicles, we get $7,500 from ComEd, and we also apply for the $7,500 to the IRS. So there's, in many cases, these vehicles are significantly cheaper day one for us, and then the fuel savings and maintenance savings that we get after that. So it's been very successful.
And then the second question, I was interested in the lot parking for the
Charging stations.
So I ended up borrowing the car and had to charge it. The station that I went to, it had one rate for like an hour. And then I stayed beyond 2 hours, it significantly increased. Would something like that help get people off of this like 8 hour thing? Or is it just that they're parking, going to work and then coming back and that's why they're having?
Yeah, so we did that a couple of, maybe a year and a half ago. We added sort of like a parking fee after 2 hours. So you can park there for 2 hours and the fee is just the fair cost of the energy. And then after 2 hours, I think it's $3. And so the thought behind that is to encourage turnover at these stations. Downtown stations are where most of ours are focused right now. And so that's where it would become a problem at a public transit lot. The first person that gets there for the day is the person that gets that charger all the time. If you put a fee that went into effect while they happen to be downtown, then they're kind of stuck there and they get that fee every hour. So that's kind of the challenge that presents.
Have we investigated public-private partnerships for these charging stations for places that people naturally go and stay for an hour, 2 hours, as opposed to, I mean, like the public parking lots, sure, but grocery stores, I mean, Westfield is doing its own thing, fine. But other destinations where it would make more sense and have that kind of timeline, dance studio, you know, a restaurant, you know.
Sketchbook has a couple.
So
I've right.
You know, the bunch of stuff.
So that's a good. That's, I mean, it's a good option, if they're on an act that's close to the proper. So, so are we investigating public-private partnerships?
So I have not directly investigated or proactively gone out there. I was in contact with Sketchbook when they had some interest in doing one and we worked together and kind of pointed them in a direction to assist with their install. But right now we're just focusing on our own lots. We have enough lots throughout town that we can try to support a multifamily and a business area nearby. And so that's why we're working at those opportunities.
Scooters. Oh, I'm
Yeah.
sorry, trustee Iverson.
Just a quick, you've had meetings or opportunities for landscapers and other businesses to come in and you've been able to explain things to them. Have you helped them understand the costs involved and the savings that they're gonna face, the issues? You're able to pull a trailer for charging. I have no idea what costs are involved with that, but I know that's a lot of the concerns that I've heard from people, is that the way they operate would be, you know, severely harmed by going to electrical. Have you had that conversation?
I mean, we're willing to talk to anybody who has any questions and share our knowledge with them, but that's one of the challenges that we discovered was charging for them. We're very fortunate to be able to park at a place where we can charge our trailer overnight. We're fortunate to be able to buy an electric vehicle to tow that and be operating within town and not having to travel long distances. So I think our situation is a little unique that we're able to pull it off, and we found that it was very difficult for some of the landscapers to be able to run their operation the same way. While the savings might be there or the benefits from running the electric equipment, the challenge of charging still presented itself for them.
See, one other, which leads to the other thought I was having, that our infrastructure, our villages is so incredibly well suited for what you're doing with electrical vehicles. And I wonder if you have worked up financials or a cost benefit analysis to illustrate, hey, here's what we've invested, here's what sort of return we're getting from this. And even without the credits that we've received, and the grants that we've received, it seems like an incredibly profitable way to proceed. Have you done that sort of analysis?
No, not for private companies, but these private companies would, what,
You mean just for,
For the village.
you just wanna know
Operating
about
expenses,
the impact on village operations.
yeah, we've done it before purchasing the vehicle, for our purchases. What I was gonna say too is these private businesses, they can benefit from the same, rebates from ComEd that we do, as well as ComEd has a make-ready infrastructure rebate. So a lot of the infrastructure upgrades that they might need to do, which has been very beneficial for us as well. These companies would be able to qualify for that, for their business too.
But
Go ahead.
what I'm thinking of is, you know, if someone were to say that, why are we wasting money on these EVs?
Mhm.
They're stupid. If I was able to say to them, well, look. Here's, here's grants.
Yeah.
It's fine, but here's our investments, and here's what our maintenance looks like
Yeah.
today. Here's what the charging stations cost us, but here's how much we're saving in gas.
Yeah,
This investment is paying high rates of return for us, and it's worth doing and doing a lot more. Is there anything like that?
yeah, we've definitely done that with vehicles. Like I said, some of these are break even at the base purchase price, and from day one, and then fuel savings could be up to $3,000 a year, and then the maintenance is basically non-existent.
I think what would be helpful would be to have some kind of an average percentage. Like on average, with everything we've bought, everything we've saved, we're saving an average 20%, 25, even
But
whatever.
of course, the impact on the
Sustainability,
plan.
right, the
Yeah.
intangibles, right, and contributing to the sustainability, yes.
Are they concerned about the terror?
Yes. So far, we haven't seen a huge impact on the automotive parts. We have other vendors outside of the automotive world. I've been given updated pricing on some things, aluminum from Canada. So yes, so we're watching it, but it's changing frequently.
Scooters.
Scooters.
Divvy bikes. Divvy bikes.
Maybe I'll start and Max, you can add in. And so community development and the planning department have always had an interest in this opportunity for the community. Many years ago, and Max was involved with this, there was actually a zip car, the opportunity to share a car in a public lot. And so that was in the downtown. We continue to have conversations periodically with Divvy about bicycles. We've been encouraged. There's been a few more bicycles that have landed in town. And so there's kind of a growing interest in that. And so the conversations are becoming more positive, but we haven't yet gotten to the point of having an arrangement with Divvy. But the planning department continues to pursue that, and we're interested in making that happen. If you have anything you want to add.
Do you have anything on Divvy? No.
Okay.
No.
Or scooters?
Scooters, I don't know where we lie with scooters. I'll put it this way. I certainly have gotten inquiries, and this is over more than 1 year, probably in the last couple of years, from scooter companies, people, companies, entities wanting to pursue that here, and I think SEAC has been ambivalent.
Well,
might be
They're very interested in, it's called like the last mile and coming up with solutions for that. I think where the issue lies is they haven't seen it well executed with the scooters.
yes.
Is they kind of lay around everywhere and the companies don't come up. Yeah, right.
Yeah, and yeah, I think there's some real concern, as you might imagine, from the cycling community. Real concern about what people have seen on, sidewalks and conflicts with them. So I feel like the conversations we've had we're like, we don't know what to do with them. We're not sure we love them. Although we there are so many transportation devices that are out there now every day. So it merits more study.
Fair enough.
Is the revenue share that Bigby would provide the city, was it like substantial enough to move forward with it?
The capital, the initial capital expense is all on the village and it's significant. And so that's a pretty big hurdle.
And we're still trying to bikerize,
Right.
the village.
Right.
Yeah.
Complete streets.
Do you have other topics?
Do you want us to talk about waste tonnage or compost for a second, or you want us just to see if there are questions? It's up to you.
That's you.
I have a, I guess, forest food stuff. I know the budget for pruning has increased, and I know we have plans to continue to plant more trees. Does that mean that it continue to go up too, and we're just gonna have this like astronomical pruning budget because we keep planting more trees, but we need more trees?
Even though we are planting a lot more trees, we're constantly removing trees as well, and so, it's really hard for us to increase percentages of trees, so I don't think there's gonna be anything very impactful, you know, down the road, as far as adding more trees. Also, the nice thing about trees is they take a while to grow, and so by adding a lot more trees, the young trees are, I wanna say like under $10 or something to prune for the first time, so I don't see any impact in the foreseeable decades that would be too much for that.
We do have a set schedule. We want to get through town on a specific cycle so that we're touching a tree within X number of years. And that's important because when a big storm comes through, if there's branches and so forth, we don't want to damage people's private property. So we stay committed to that cycle and we want to get rid of any potential damage that, that a tree could cause on private property. So that's part of the methodology behind, the cost increase because we had to stick to our schedule.
Does the pruning also go around like the power lines, but I know some of those things look like.
That's comment.
Yeah,
I'm
sure.
sure.
Oh,
Comment
does hear that.
Yeah.
Okay, amazing. Great.
That's right.
Right out of the electric bill.
And they're pretty aggressive with some of their cuts because they only want to come back and touch that tree every so often. And so that's why it's pretty aggressive when they come through.
Trustee Schechter.
Since we're going to different topics, my question relates to evaluating the streets. Noticed, I know that's under your purview. Russell has talked about this, but I've said this several times. And one of the big issues that all of us here, people who feel that their streets don't use some calming, we want to put it that way, either by stop signs or lowering the speed limit, and just wonder, what kind of valuation you're looking to do, or.
So I'm gonna jump in real quick and certainly if staff wants to say something, they should. But we are going to have a presentation at next Monday night's board meeting about this subtotal. So we will be getting more detailed information about the process that engineering staff goes through to determine or that they have to date, what they have done to date.
And just wanted a general sense of what is even, when people say, oh, I just want a stop sign, like what is that cost? What does that look like? What is that, do we allocate a certain amount in the annual budget for those eventualities?
It's a good question. It's not a cost issue. Yes, we have to monitor. Once we put in a sign, we have to maintain it and so forth and make sure that it stays at a right angle. But it's really the science behind whether or not the traffic and the experience of an intersection requires it. Because what research has shown is if a stop sign goes in and it's not warranted, it doesn't meet that objective criteria, then it becomes more dangerous. And so Samantha, our senior engineer, has been with us for a number of years and really is the expert on analyzing our traffic. And so she can speak more eloquently to it, but that's a little bit of a background of how.
Yeah, just to add, we do have a process in which when, we do get a lot of complaints from residents in terms of, speeding on the street or stop signs, because they like to a lot of the times equate those two as being hand in hand. And so we kind of go through the process of initiating an engineering study. So we follow engineering standards, follow federal guidelines. We've adopted federal guidelines as a part of our own when evaluating stop signs. And so when we go and we do an engineering study, we take a look at crash histories, field investigate, site distance issues, and volume counts. Those are really the main triggers for when a stop sign is required. And in terms of speeding, we do have a program where we can see what the speeds are within Skokie on every block. So we use that to kind of gauge and see, where are the hot spots in town. We work hand in hand with police to communicate with them on the times of day we're seeing. If we see any sort of issue on that street, as Ann and John kind of alluded, will be kind of the next board meeting, really getting into some of the speed study that we just completed and hopefully proposing a reduction to a village-wide speed limit.
So I was gonna ask you about that. So the possibility of reduction to 25 miles per hour unless otherwise posted, correct?
Yes.
Is that what you're?
Yes, for all local residential streets. So not any streets that we do not own. We do not have jurisdiction on.
Trustee Levy?
So when you talk about things like implementing a village-wide lower speed limit, that then becomes an enforcement issue rather than like an engineering issue. And if we already are tasking our police force with so many things, could this be solved with engineering versus enforcement?
Well, so the main thing I think with both police and engineering, will hopefully work hand in hand, and the deployment is really the education piece. A lot of people don't know what the village speed limit is in town, and what the effects of speed are. So I think really that's really first key is to really deploy an education campaign on what the changes that are coming. If it gets approved, and absolutely we do have a complete streets policy where any major project, especially if it involves grant funding or federal grant funding, we do look at all possible ways of how do we design something to calm traffic, but that also works for all users of the roadway, not just vehicles.
Thank you. Any other questions? Do you want to talk for just a moment about refuse and compost?
Yeah, sure. The cool thing about the waste management is it's really all about the residents, and it's their story to tell. And I just wanted to highlight for sure our refuse tonnage this year is the lowest, with the exception of 2011, which was a major recession, which is very tied to tonnage, since we started recording data in like 1994, 1995.
Right.
And we've now seen, a couple of years that have, after COVID, after we went down from COVID, we've seen this trend continue downward. So I think that's the big story of this year. And we've seen recycling go up. We've seen composting go up. We had our first ever household hazardous waste event that was fully booked last July. Residents have been signing up for the new household hazardous waste program, where you can do like an at-home collection for a share cost fee. And then we just launched that hefty program, which is absolutely free to us. So great news from a budget standpoint. And we don't expect to see a lot of tonnage numbers with that, but we expect to see gains on volume. That it's light packaging, but it takes up a lot of space. So we're launching that program, throughout the year. I really want to give a shout out to the Sustainability Commission. They were giving away the kits at the last winter market. And we're gonna have some more staff giving away kits at Festival of Cultures, and we're just trying to promote that program. So, but it's been a really good waste story to tell, and the residents have been knocking it out of the park.
You should talk to the people that need it by name to see if we can have that come out. Yeah. I'm saying that as a joke because I.
Yeah.
I have a question about, and I'm sure we'll talk about this more tomorrow night with the health department. But I'd appreciate just hearing from Public Works how our staff interact with the health department about rodent abatement. What does that collaboration look like?
Well, there's frequent interaction, between our staffs and then, as I'm sure you know, and I don't know how many people in the community know this, but there is an internal committee that we call the RAT committee. That I have had the distinction of being on for many years, as has Liz, and now Brad is a member of that group. But that group includes members of the health department, includes representatives from property standards, and includes representatives from the village manager's office. And so we meet monthly to review what's going on with rodent numbers, what's going on with abatement activities, what are our trends look like, because each of those departmental functions, property standards, public works in terms of the refuse collection, health department, obviously doing the program, doing the baiting, doing the site visits, everybody has, a role to play in this. And so there's regular monthly formalized interaction amongst the management of those departments that are involved in the rodent abatement program. And then pushing down a level or two of staff, there is, I would say, day-to-day contact that takes place amongst, from the refuse supervisor to individual property standards, inspectors.
That's what I was wondering
Yeah.
more about. Okay.
Yeah.
Trustee Schechter.
Yeah, no, I appreciate that you asked that question, Mayor, and your response, and I have to say, when I saw that point here, that you have these interdepartmental teams, I was thinking that this is and the way you described it, it's a model, I think, that the village could be using for other issues. Because it basically says there's a will of this village, the entire village to address this problem. We're going to put all these resources, we're going to coordinate, and we're going to get it done. And I guess the number of incidents has gone down by half, right? So I think that's a great model. Stan.
Yes, sir.
I just had a quick comment question, and it's one of these things where it blurs with your friends at the building department. There's often things where your work and their work combine. So the Commonwealth Edison Fields on the northwest side of the village.
Yep.
We live right next to those. When Terry O'Lean was here, he was all over them like white on rice to get them to cut that the same level as everybody else. Right now, that field is infested with a invasive weed from Africa known as henbit, Henbit. And it's all over the 9300 block of Laurel and Long. And now every house on the block, one block in each direction is filled with it too. I spent the whole spring trying to remove it. It's impossible to remove it without getting it resodded. I seek to start a dialogue with you and building property standards about returning that maintenance to the level that Terry O'Lean once kept it before the pandemic. And we need a plan to remove that henbit fully from not only the ComEd land, but all the lands that's been destroyed by it now on the other sides. In addition, recently, there was I don't know if this was done with a building permit or not. John Lockerbie would have somebody look that up tomorrow, but they replaced the telephone pole on the alley. And they did it with 3 feet of cement in every direction around it, in a public field in the middle of property that's supposed to be park-like. There was actually once a petition for that land to become a Skokie Park. I still have a copy of it. My father circulated it. So I don't know what's going on with that stuff, and I'm sure it's not the only place in the village with that problem. But, you know, there's some things like that where there's gray areas between the two departments, and it's sometimes unclear to me who should do what, and as I skimmed the budget, I didn't really see any initiatives about any of those things.
So property standards is overseen by Angel Schnorr, and so she's the person that would oversee those items.
Staff has made a note. I'm sure they'll follow up with comment. Thank you.
Thank you.
Any other questions for Public Works? Okay, if not, any additional public comments?
I have some.
Okay, you've got about 3 minutes.
Perfect. It won't even take me that long.
Great.
So on page 497 of this budget, it mentions $250,000 for open crosswalk maintenance. It mentions $425,000 for brick maintenance on West Dempster Street and $250,000 for decorative crosswalks on West Dempster Street, and also includes a line item for $150,000 for Church Street bike lanes. My parents' house at 9330 Laurel, Lorel, for those who think I just said Lowell instead of Laurel, because that's a common mistake in this village. There's only 4 roads in and out of that area. One of them is being blocked by a school district that's run amok at District 68 currently. So the only way to get in and out of the area there is Church Street. There's 2 lanes of traffic and 1 left turn lane each there. It's gridlocked. I invited any trustee to come by there any day at 3 p.m. and see the chaos during the school year. But you know, the reason I object to these numbers on page 497 is that for now 8 years in a row, Church Street between the Morton Grove border and Grosse Pointe has still not been repaved, despite the promises of the gentleman that worked for the village manager's office at present, that it would be. That I have emails going back all the way to 2018 saying it will be done next year. I find these expenditures to be absolutely frivolous, especially considering the fact that we were once promised that the village was going to pave the road and then bill the county. When is this going to happen, Mr. Lockerbie? We've been getting your promises for years, and now we're spending millions of dollars on decorative crap. And the south end of the village and the other things that are here. Church Street needs to be repaved this spring or this summer before next winter.
Thank you for your comments.
These expenditures need to be cut.
Appreciate your input. Thank you. Thank you. Anything else? If not, I ask for, oh, yes, please.
I was going to move to adjourn.
Thank you. Is there a second?
I read your mind, Mayor.
Trustee, thank you, Trustee Levy. Will the clerk please call the roll?
Trustee Verslogan,
Yes.
trustee Schechter,
Yes.
trustee Kate Levy,
Yes.
trustee Robinson,
All right.
trustee Iverson,
Yeah.
trustee Elby.